Hi everyone, this is Dr. Omar. In this video clip, I will show you how to do non-parametric tests in SPSS. There are four main tests. The first one is Mann-Whitney U test. The second one is Wilcoxon Sign Rank test. The third one is Kruskal-Wallis test, followed by post hoc test. And the fourth one is the Friedman's ANOVA test, followed by post hoc test. The first test is the Mann-Whitney U test. That is a non-parametric test. I have here a data that I had made myself. When we have in the first column, on the left hand side, the gender, two groups. In each group there are 10 individual, male and females. And in the second column is the weight. We take the measurement for the weight of the individual in both groups. This is a continuous or a scale data in the weight, as we know. Satisfaction is, are you satisfied, agree, disagree, strongly agree, strongly disagree. So from 1 to 5. Again, this column is ordinal, this column is continuous or scale. So to do the Mann-Whitney U test is very straightforward and easy test. Click on the analysis, scroll down to non-parametric, and then scroll down again to legacy dialogues, and scroll again to two independent samples. And I have to reset this, and a window will appear, and we need to sort and transport these variables and cases into relevant suitable boxes. So we need to test this variable. We need to test the weight to see if there is a difference between the male and the female in terms of the weight, and also there is a difference between satisfaction in terms of they agree or don't they agree with specific criteria. Satisfaction is also in a variable list. Now we want to group it based on the gender, male and female, and we need to click on define. Group 1, we give it number 1. Group 2, we give it number 2. Why did I select 1 and 2? Because I labeled these ones. I've labeled this as 1 and I labeled these as 2. Click on continue, and then I will select here the Mann-Whitney U test, and then I will click also on exact, and I will stick to asymptomatic only. Click on OK. Then the options, there's not that much illness, we need to get some descriptive. We'll click on descriptive. Click on continue, then click on OK. SPSS output will appear in there as we have seen here. We have 20 cases, 10 males and 10 females, and the mean for the weight is 8.8 for the whole group, and for the satisfaction is 2.4. Now if we look at the rank, this is what the software has done. Rank them. There are 10 male, 10 female. One's variable is the weight, the other variable is satisfaction. And as we can see here is the female rank for weight, and male the rank also mean rank for satisfaction. Now this is the most important part of the analysis here, an outcome. As we can see here, the Mann-Whitney U test has been calculated for both weight and satisfaction, and Wilcoxon also. And the most important part is the significance. As we can see here, these analyses show that there is a significant difference between the male and female in terms of weight and satisfaction, because the p-value is less than 0.05. And this is considered to be significant. So there is a difference between these two groups, male and female, in terms of their weights and in terms of their satisfaction. So this is the way to do a Mann-Whitney U test. The second test is the Wilcoxon Sign Rank test. I have here a pre-entered data on 10 patients. So I have patient 1 to number 1 to number 10, and they have been treated with a drug that is really relevant to the cure obesity and reduces the weight. And then these numbers are the weight of the individual before taking the treatment, and the column after and the post, and then the next column is the weight after taking the drug. And as we can see here, weight does vary pre and post treatment. So we need to see where there is compare a difference between these two conditions, pre-treatment and post-treatment, on the same individual. So it's the same sample, per sample, same patient, both before taking the drug and after taking the drug, and looking at the effect, the drug, whether the drug is really effective in reducing the weight of a person. And for this data, we need to use Wilcoxon Sign Rank test. To do that, we click on Analyze, scroll down to non-parametric test, and then click on Legacy Dialogues, and then scroll down to 2 related samples. Here we need to use the 2 related because these samples are related. Another window will appear, and in this you need you need to fill in a way that which 2 variable you want to compare. We need let me do a reset for it. So we need to transfer the pre-treatment to the variable 1 and post-treatment to the variable 2. So we need to compare these 2 variables to see if there is any significant differences between them. If we click on exact, I will keep asymptomatic only as it is and do nothing at the current stage. I will not use Monte Carlo nor exact. Probably in subsequent video show you how it's significant, what's the difference, but we will stick with asymptomatic only, asymptomatic, and then click on continue, and then click on the Wilcoxon icon here, and then click OK. Now this is the output of SPSS. It's telling you that you have 10 samples and they have been put in a rank, and this is the rank for it, 5.5. Now this is small table here is the finding for the statistical analysis. This statistical analysis with using Wilcoxon Sign Rank test, it's saying that there is a significant differences between the 2 conditions, as the p-value were below that 0.05. And so this is the way to do Wilcoxon Sign Rank test on a sample that has 2 measurements that are paired measurement, i.e. the same person has been subject to different treatment. The third test is the Kruskal-Wallis test. In data window, I have generated really here a result or data in which in this data I had really 21 participants in a study in which a new drug has been produced, and I need to test the efficacy and effect of this drug on one of the variable in effect on one of the blood components, the efficacy of it. So this group has been divided into 3. The first group is being given a placebo, which is really not a drug, anything like water or salt and so on. The second group just giving single dose of the drug. The third group given a double dose of the drug. And then the drug efficacy was measured, as we have seen here, through a number and given a number. So as we can see here, the group size is small. All the groups are 7 in each group. There's 7 participants, and I've checked the distribution of the data in the drug section or variable, and it was not normally distributed. So how can we really calculate the significance of the drug between these groups? Okay, the way to do it is to click on Analyze, scroll down to the non-parametric test, because this is non-parametric data, and then click on Legacy, then scroll down to K independent. K indicate that more than 2 samples. Click on that and then reset that. Another window will appear. In that window there is a test type called Carescale. We'll click on that. So we need the Carescale-Wallis test. We'll try to transfer the drug into the variable list to test the variable. Participant, we will move it into the group variable. And in the group variable, I'm going to tell the software, hey, listen, I want you to look at the group from number 1. Number 1, I give it has been assigned for placebo, to maximum number 3. 3 is from 1 to 3. So the placebo, single dose and double dose. And then click on OK, continue. For the exact, then click in the exact test, we'll just give it a symptomatic only. And then the options, I will select descriptive, and then I will click on continue. Then hit the button for OK, and then an output SPSS window will appear telling you the drugs has been there are 21 participants on this study. It will calculate the mean and the standard deviation. However, what's important, as this is descriptive data, Carescale-Wallis test, as we can see here, 3 groups: placebo, single dose, double dose. And again, as you can see, there are 7 participant individuals in each group. And if we look at the Carescale ignored the value of each number in the drug, and rank them. Didn't work in the actual data. It took these data and ranked them and put them in rank and gave it a rank. So the mean rank for the placebo is 4.2, and for single dose 13, and for double doses 14.93. As we can see, there is a difference in the mean between placebo and single dose, placebo and double dose, but there is no difference, not significant, not that much difference, let's say, between single dose and double dose. Now, Carescale-Wallis test in SPSS has calculated the overall significance and comparison between these 3 groups, and found out that there is a significant differences between these groups, i.e. taking the drugs make changes, but doesn't specify which 2 groups are significant and which are not significant. As we can see here, the mean rank between single dose and double dose is very close. So if I want to find out which groups really giving has a significant difference, statistically significant difference or effect of the drug, we need again, instead, in addition to do Carescale, to go back again and do Mann-Whitney U test for placebo and single dose, placebo and double dose, then single dose and double dose. And I will show you really how to do it. I've already shown you how to use Mann-Whitney U test in a previous video clip. You can have a look at it. But the way to do it is to go Analyze, click on non-parametric again, and then click on Legacy dialog, and then we need to click on 2 independent, because these data we have are independent. So we click on that, reset that again, and I need to click here on Mann-Whitney U test. I need to put the drug in the testing 1 and the participant here, and I will come, and then I want to define the group. Here we need to test 2 groups together. So group number 1 is the placebo type 1, and group number 2 is the first single dose. Click on continue. We'll leave this window is exactly the same. For option, we'll take only click on descriptive, and then we'll click on continue. Hit the OK button, and voila, we see here that the Mann-Whitney U test has been calculated for placebo and single dose, and it was found that there is a significant difference, that if you get the first dose of the drug, you get really a difference between control placebo, which is the control, and the single dose. So there is a significant difference. Now let's see if there is a significant difference between a placebo and double dose. So we'll keep group 1 is the placebo, group 3 is the double dose. Click on OK, keep everything, and click hit OK. Again, we can see that in this test, the value is again also 0.1 between placebo and double dose of the drug. Now if we again go back again and we do also the same test, but instead of comparing 1 to 3, we click on 2 to 3, click OK, keep everything the same, and again Mann-Whitney U test has calculated the significant difference between single dose and double dose, and as you can see here, there is in fact no differences between the single dose and a double dose, as this p-value was 0.6. From this data we can really show that has shown that Kruskal-Wallis test that tell you that there is a difference, significant difference between all these three groups, but it doesn't tell you which group with which group has really significant. We have found out that placebo with single dose is have a really significant difference. Placebo with double, significant difference. But once we compare the single dose with a double dose, we couldn't find a significant difference. That's indicate that giving an individual single dose or a double dose will have the same effect compared to placebo. This is the way to do Kruskal-Wallis test, and then to do a sub-test to determine which of the subgroup that have really statistically significant. Post hoc test is another test that is done following the Kruskal-Wallis test, just as a complementary for the test. In this data view, I have three group number 1, which is a control, 2 is the 1 week, and 3 is 2 weeks. So these three groups, a new novel drug has been designed, and its effect has been followed up using specific parameter in the blood. So we want to compare the efficacy of the drug after using it for 1 week and 2 weeks compared to a control. Again, I've double checked the distribution of each group, control week 1 and week 2, and they are not normally distributed. So how can we do Kruskal-Wallis test to determine the significance, whether there is a significance between these groups? Click in Analyze, scroll down to non-parametric test, and then to Legacy dialog, and then we click in on the icon for K independent samples. Reset this. Okay, so I'm going to transfer the drug into test variable list and the participant into group variable. And in the participants, I want the range to be from group number 1, in which I gave the control value 1, and to the week 2, which is value 3, and week 1 is value 2. Click on continue, click on the icon for Kruskal-Wallis, and then click on exact. We'll leave a new window will appear. We'll leave the asymptomatic only test as it is. Click continue. On the options, we will just click on the descriptive, and then we click continue. Hit the button for OK. SPSS will produce these tables. As it says here, 21 participants involved in this study, and out of these 21, 7 were controlled, 7 week. Drug has been given for 1 week and 2 weeks, or 2 weeks. And what has this Carescale-Wallis test done is took the actual data for each one of these and sort them into ranks, and then calculate the mean rank. And we can see from the mean rank that control compared to 1 week is really, there is a huge difference
from 4.2 to 13. And from control to 2 weeks is 14, also from 4 to 14. However, there is no big difference between the mean rank of week 1 and week 2. The test produced a significant value, p-value, and the p-value is lower than 0.05, which really indicates that there is a difference between patient who or individual participant who has taken the drug for a week compared to control, or 2 weeks compared to control. But it doesn't tell you if the difference where there is a difference, significant difference between the control and the week, or the control week 1 or week 2, or week 1 or week 2. It's just give you a p-value for all 3 groups. And now to nail down this into which 2 groups really are significant, which are not, as I showed you in the previous video clip, we can go and do Mann-Whitney U test on 2 samples, control on week 1, control on weeks 2 weeks, and weeks 1 and week 2. However, there is another way to do it, which is called post hoc test. To do a post hoc test, I'll go click on Analyze, scroll down to non-parametric test, click on the independent samples, click Reset here, Objective. So in this icon, in this window, will appear and ask you what is your objective. Say I want to customize the analysis. I want to tell the software what to do. Click on there in the field. I'll transfer the drug into the test field and the participant into the groups. And then in the last icon here is the settings. So what I want also to the setting, I will click on Customize Test, and I will click on Carescale-Wallis one way, and it automatically says do multiple comparison pairs, all pairwise. So it will do a pairwise between control and week 1, control week 2, week 1 and week 2, weeks 2 together, or 2 weeks together. So I'll hit the run, and then a small table saying here that the hypothesis testing that there is a difference between the 3 groups, and the difference is 0.002, and to find out which 2 groups really have a significant value and which are not, double click on the table, and then another window will appear showing you the box plot for control 1 week and 2 weeks. As you can see, there is not that much difference from this diagram between 1 week and 2 weeks, but there is really a difference between controls and week 1 and 2 weeks. And then we click in another one called pairwise comparison. That's a table will appear here. That's the table that will really do the comparison of control 1 and week 1 week, and it's give a significant value of 0.012 when a test has been done between control and 2 weeks. It's give less than 0.05, significant. However, when we compare week 1 with week 2, there was no significant. The value was 1. So this table tell you, Kruskal-Wallis tell you that there is a significant difference between all the 3 groups. This table, post hoc test, will tell you that control and week 1 is significant, control and 2 weeks significant. However, there is no significance between 1 week and 2 weeks. So from this data, we conclude that a patient giving this drug, or individual giving this drug, taking it for 1 week is more than enough to have an effect, as 2 weeks and 1 week effect is nearly similar. This is the way to show you Carescale-Wallis tests, followed by post hoc.
The final 4th major non-parametric test in SPSS is the Friedman's ANOVA test. This is a data taken from 10 participants in this study, participant 1 to 10, and a body weight was measured at specific point time on that study. The aim was to look for the effect of exercise on the body weight. So each individual body weight was measured at 0.0 before the exercise, and then body weight was measured at after 1 month of the exercise, and the individual was doing a half an hour exercise sport per day. And then at the end of 2 months also the body weight was measured again. So we can see here from this data that each individual has a measurement. So these all 3 columns are related. So these data are related. And if we want to find out if there is a difference between all these 3 variables or samples, since they are small, 10 cases, and the distribution of the data on each group is not normally distributed. I have checked that, and I will show you in a future video clip how to do that. So to do the analysis on these data, non-parametric and small and not normally distributed and more than 2 groups, we click on analyze, go to click on non-parametric tests, then legacy dialog, then scroll down to K-related samples. Hit the button. You will have a window here asking you again. As you can see here, there is an icon for Friedman test. We'll click on that. We'll ignore this. I might come to this later on a subsequent video clip to explain the difference between all these 3. So I want to transfer the control to the test variables and the 1 month and 2 month. And I will click on the exact. I will keep this window the same. I will not do any further changes. I will explain in depth in future videos what is Monte Carlo and the exact. Statistics, I will click on that icon and I will select descriptive and click on continue. Then hit the button for OK. Now SPSS will generate an output. Will give you some descriptive statistics. The control, the 1 month, the 2 month. The samples in it 10, and then it will work out the mean for each body weight in each group and the standard deviation. However, this is not of our concern. Our concern is really Friedman test. So what have Friedman test did in this SPSS? It took the data from the control month and 2 months and put them into rank and worked on the rank, and then calculated the significant difference between all the 3 groups. And again, the Friedman generated a p-value that is less than 0.05. So these data and this analysis, this test shows that there is a significant difference between the 3 groups. But it doesn't, so there is a difference if you exercise 1 month or 2 months compared to 0 exercise. But that test doesn't tell you which groups, 2 groups together, are significant and which are not. So there are 2 ways to do that. I think I will show you one in another video clip. I'll show the other one. I'll show you another way. So there is one way. One way to do that is to go to do paired tests, non-parametric paired test. A non-parametric paired test is a Wilcoxon Sign Rank test. To do that, we click on analyze, back again to non-parametric test, then legacy dialog, and instead of clicking K-related for this K for more than 2 samples, we'll go for 2 related samples. A window will appear, and as you can see here, Wilcoxon test is icon is clicked on. So what does this test do? Will compare the variable between control and 1 month control and 2 month, and then 1 month and 2 month. To do that, we click on control and click on it. So, and then I want to compare control into month 1. Click on it. And then again, I want to compare control to 2 months. Click on that. and then I want to also to compare 1 month to 2 months. So here now I have a combination comparing control to 1 month, control to 2 months, and then 1 month to 2 months. Here I will click on exact, and as I can see here, we will just leave this window as it is and hit the continue. On the options, I will click on descriptive, and I will click on continue, and then I click OK. Now hit the button for OK. This Wilcoxon Sign Rank test is calculated, and as we can see here in this Wilcoxon, similar to Friedman, put the data, take the actual data in 2 groups and put them in ranks, and then compare the data in 1 month to control, and 2 months into control, and 1 month to 2 months, and it works out the mean rank for each combination of group. And we scroll down to the last table. We see here that Wilcoxon has worked out the value for comparing 2 groups. Month with control, here it does say there is no significant differences as the p-value is more than 0.05. However, control with 2 months, there is significant difference, and with 1 month and 2 months, there is a significant difference. So this is really the way to find out which groups, 2 groups, have a really significant differences, or do have a significant density differences when they compare to each other. So, and if you are using Friedman, you probably need, if you want to further detail and further information on if there is a significant difference, is to do followed up by Wilcoxon Sign Rank test to follow up and find out which 2 groups really had a significant difference and which are not. Finally, the post hoc test can be done following a Friedman ANOVA test as a complementary test. Here I have a data from a company that has introduced a drug, wanted to test the effect of the drug on an individual's in a period of time from 2 weeks to 4 weeks, and to follow that by looking at the body weight of an individual. So a drug designed to supposedly reduce the body weight. So in this study we have 10 cases, 10 participants, and every one of them participated in all the measurements. At the 0 point, or at the beginning of the test or trial of this drug, the weight for all the individual has been measured and taken, and then after taking the drug for 2 weeks, their body weight were remeasured again, and after 4 weeks the body weight was weights for all of them were determined. These data, as we can see, the sample size is too small, 10 samples, and each individual participated in all the other measurements, so they are related, the variable here are related, and these data in each group is not normally distributed. So thus, if we want to find if there is a significant difference between taking a drug for 2 weeks or 4 weeks on the body weight, the best way to do it is to do Friedman ANOVA test. And to do that, we click on Analyze, scroll down to non-parametric test, then scroll again to Legacy Dialog, and then scroll to the K-related samples. Here another windows appear. We need to select the control weeks 2 and weeks 4, and transfer them into the test variable to test for several related samples. And as we can see here, we keep this Friedman on clicked icon clicked on. If we click on exact, a window will pop up. We'll just leave it as it is and click on continue. Statistics, I will pick up and click on descriptive, and then I will click on continue and then hit the button for OK. SPSS generate an output.
showing you that there are 10 cases and 3 groups, and SPSS, Friedman, ANOVA took the data for each group, actual data, and rank them, and then give the mean rank for each group. Again, these data show that there is a significant differences between all the 3 groups, but again, it's an overall significant, but doesn't specify what is, if there is a significant between control and weeks 2 or control and weeks 4. And the way to do that is, as I said in a previous video, you can do it through Wilcoxon Sign Rank test or post hoc. Here I will show you how to do post hoc test. So again, we click on Analyze, we scroll down to non-parametric, and then scroll down again to click on that test which is called Related Samples. If you double click on that, a window will come up. It's asking you what is your objective. I say click on I just want to customize the analysis. Then go and choose the field. Again, these are the 3 fields that I want to choose and I want to test, so I will transfer them to the right box. And then I will also click on the setting, and in this setting, in this window, I will also select customize test. I will go down here and click on Friedman, ANOVA by ranks, okay, samples, and all giving you all by pairwise. Then click on run. A box will appear showing that there is a significant difference between the 3 samples, and it's really put an hypothesis, and it says that there are significant less than 0.05. If you double click on this table, get another window here next to it showing the control, the week 2 and week 3. If we scroll down to here and click on pairwise comparison, another table will appear, and this table really is showing the comparison between control and week 2, control and week 4, week 2 and week 4. Again, these as we can see here with this post hoc test, it shows that there is no significant difference between control and week 2. However, because the p-value is equal to 1. However, there is a significant difference between control and week 4. So, and there's also some significant difference between week 2 and week 4, as the p-value is less than 0.05.
So as a final recap, there are 4 major non-parametric tests in SPSS. Which one to use depends on the group you have, whether you have 2 groups or 3 or more groups, and whether these groups are related or not. If you have 2 groups that are not related, then Mann-Whitney U test is the one to use. If the 2 groups are paired or related, then Wilcoxon Sign Rank test is the one to choose. If you have 3 groups or more that are not related, then Kruskal-Wallis test is the one. And if these 3 groups or more are related, then Friedman's ANOVA test is the one to go for.